Welcome to the sixth lecture in this module, and in this lecture we're going to cover the use of cannabis-based medicines in gastrointestinal disorders. So this is going to include inflammatory bowel disease, which covers Crohn's disease and colitis. We're also going to cover nausea and low appetite, but specifically in a non-cancer setting, because the next lecture we're going to talk about the use of cannabis-based medicines related to chemotherapy nausea. So why do I need to know this? The endocannabinoid system, so all components of the endocannabinoid system and the cannabinoid receptors are very highly expressed throughout the gastrointestinal tract, which means that cannabis and cannabinoids have a significant impact on all aspects of gastrointestinal function. And people have been using cannabis for a long time for their GI effects. We have long and widespread anecdotal use of cannabis-based medicines for GI disorders, from cramps, nausea, diarrhea, constipation. All aspects of gastrointestinal dysfunction have been treated with cannabis. And we also know very well that cannabis stimulates appetite, and this is often known as the munchies, and it's a well-characterized response of cannabis that specifically comes from the THC within cannabis, and I'll talk to you a little bit more about how that's brought about. There is a growing evidence base that there is a therapeutic benefit of cannabis-based medicines in a variety of gastrointestinal disorders. So I'm not just talking about anecdotal evidence, but actual clinical trial evidence that cannabis-based medicines are useful in inflammatory bowel disease, for stimulating appetite and for reducing nausea in a non-cancer setting. And these are the areas that will be covered in this lecture. And it's also important to remember that actually gastrointestinal side effects are one of the main side effects that are known to occur with cannabis-based medicines. And this really relates back to my first point, that the endocannabinoid system is very highly expressed throughout the gastrointestinal tract. So clearly there will be both benefits and also negative impacts on the GI tract. So some of the common side effects of cannabis-based medicines are either diarrhea or nausea, or can be changes in appetite. It can be stimulation of appetite or loss of appetite, both of which can be side effects in the wrong indication. And also in extreme cases, we have what's known as cannabis hyperemesis syndrome, which is where people experience severe vomiting in response to cannabis. So I'll start with a bit of an overview on what inflammatory bowel disease is, often abbreviated to IBD. So inflammatory bowel disease covers two different disorders. One is Crohn's disease, which is throughout the lower digestive tract, and the other is colitis, which is specifically localized to the colon, so that to the last portion of the gastrointestinal tract. It's a life-changing disease, so it's a lifelong disease for which there is really no cure, although surgery can be curative in some cases, but it is a lifelong and generally a disorder which can get worse with time. And it affects about 1 in 400 people in the Western world. It's characterized by chronic inflammation of the lower gastrointestinal tract, so everything below the stomach. So you can see in this diagram there, we've got areas of red where the intestines get inflamed and enlarged and thickened, and this can lead to pain and diarrhea and sepsis. And one of the major problems with inflammatory bowel disease is that the lining of our guts becomes leaky. So normally these cells form a really good barrier and prevent things that are within the digestive tract from getting into the body. But actually one of the problems with inflammatory bowel disease is that that barrier can become leaky, and so things bacteria and toxins that should be kind of kept localized within the gut are able to move into the underlying tissue and into the body, and that can lead to systemic infection and sepsis. So there are treatments available for inflammatory bowel disease, which depend on whether you have a mild, moderate or severe disease, and also how responsive you are. So the typical first line of therapy is that people are given corticosteroids or antibiotics or immunocyclates. If this doesn't work, or if the disease progresses, then you move on to more significant immunomodulators and oral corticosteroids. And if this doesn't work and the disease progresses, or you are unresponsive to the other therapies, you can end up with having surgery. The immunosuppressive agents that are available for people with IBD do possess a lot of side effects, and this is one of the issues. There's well-known side effects with steroids, and specifically chronic steroid use, such as bone marrow suppression and opportunistic infections because you are immunocompromised. As I mentioned, one of the last treatment strategies is surgery, and about 75% of people with Crohn's disease and 25% of people with ulcerative colitis will end up having surgery to remove the really diseased sections of the bowel. It's estimated that there are quite a lot of people for whom the current standard therapies don't work, and at least 1 in 5 people with ulcerative colitis don't improve with medication. And so people who work in this area will say that there is currently a great need for an effective treatment and also a well-tolerated treatment that doesn't have significant side effects to treat inflammatory bowel disease, and really just try and stop people from getting to the point where they need surgery. So I'm going to talk now about what evidence do we have that cannabinoids or cannabis-based medicines might be useful in inflammatory bowel disease. This isn't a massive research area, unlike some of the indications that I've already covered. There aren't a huge amount of studies. There's probably only about, I think, 7 or 8 that I'm going to talk to you about. So I'm going to walk you through each of the studies that has been published to date in chronological order, so you can get a bit of a feel for what the evidence base is like in this particular area. So the first study is an observational study. So remember, this is an uncontrolled trial, and the patients in this study who had Crohn's disease specifically were interviewed about their disease before and after they started cannabis use. And so this is really relying on their recall about how they used to be before they started using cannabis, and how they are now. And these were selected from people who were actually attending a medicinal cannabis clinic. So you have to bear in mind that there's probably a positive bias because these are people for whom cannabis is working. The main reason that these patients actually started cannabis was because of a lack of response to their conventional treatment. So they didn't find the therapies that they were already on were working, and so they turned to cannabis, which is a typical story really with medicinal cannabis and traditional medicines. So the patients all reported that they had improved symptoms after they initiated their medicinal cannabis, and they also said that they were able to reduce the dose, or sometimes even completely stop, some of the other medications that they were on, and this was very important to them. So this is a graph to just show that. So this is the Harvey-Bradshaw index is a survey score basically of how well you're doing with your Crohn's disease, and it will be based on a lot of different factors. So things like pain, appetite, weight loss, flare-ups, diarrhea, frequency of stools, all of these kind of things will be kind of accumulated together into a single score. And so each of the patients really self-reported that this Harvey-Bradshaw index was significantly higher before they started using cannabis, and is a lot lower now that they're using cannabis. And remember, the reason they turned to cannabis is because their current medications weren't working. So they were people who had quite severe symptoms. And they also reported a reduction in the use of other medications after they started using cannabis. So you can see that before they started using cannabis. 26 of the patients were on corticosteroids, but afterwards only 4 were. And this was similar with each of the different types of immunomodulatory medications that the patients were on. So before these medications weren't working for them, they started using medical cannabis, they started feeling a lot better, and they dropped their other medications. So this is quite a nice piece of evidence to suggest that there is a signal that cannabis-based medicines are useful in these patients. So the next study is actually a randomized controlled trial, which, if you remember our hierarchy of evidence, is where we start getting greater confidence that the results aren't in any way biased. And this is with 21 patients, so it's a small trial. It would be a phase 2 kind of proof of concept type trial. And they were actually using cannabis, inhaled cannabis in a cigarette form. And it had a controlled amount of THC in there, which was 115 milligrams of THC, or they had placebo cannabis cigarettes that didn't have THC. So the THC had been removed from those to produce a reliable placebo. And the patients who were taking the cannabis cigarettes found that their CDAI stands for the Crohn's Disease Activity Index. So this is kind of like the Harvey-Bradshaw Index, but just a slightly different version. Again, taking into account many symptoms of the disease and giving you a single number. So the patients who were using the cannabis cigarettes had a significant reduction in this index of Crohn's disease severity. And what was quite interesting, at least to me, was that when the patients stopped using the cannabis, their CDAI score returned to baseline. So it kind of indicated that once they stopped using the cannabis, they went back to how bad they were in the first place. So this graph just shows you there the placebo group are in the white column, and the cannabis smoking group are in the greyed column. And with each week, so at week 2 and at week 8, you can see that the CDAI score is significantly lower in the patients who'd used cannabis. And then what's highlighted there with the red circle is that after they stopped using cannabis, their score went back to how it was before. So this is good evidence that that cannabis, or at least THC, because that was the main active pharmaceutical ingredient in this particular trial, is useful at reducing symptoms in patients with Crohn's disease in a small randomized controlled trial. So the next study, chronologically, we're up to 2017 now, is a study that was carried out with cannabidiol. And again, looking at Crohn's disease. So there was 20 patients who had a CDAI score of greater than 200. So on this CDAI score is from 0 to 600. So this is people who had kind of moderate to severe disease. And they were given 10 milligrams twice per day of cannabidiol in olive oil. Now, for those of you who are familiar with clinical use of cannabidiol, this is really a very low dose. So typically, cannabidiol would be used in the hundreds of milligrams per dosing. So 200 to 300 milligrams twice per day would be more typical than 10 milligrams. So anyway, they did this for 8 weeks and it was placebo controlled. And what they were looking for was a reduction in the CDAI score of 70 points. So basically showing that there was symptom improvement in Crohn's symptoms, but this failed. So they didn't see any improvement in the CDAI score in the patients who'd been taking CBD for 8 weeks. Which is shown in this graph here. But really, I want to draw attention to the fact that this is a very low dose of CBD. There is preclinical data that I'll come to that has shown that CBD is very effective in Crohn's disease. And so I think the issue with this trial in hindsight is they just got the dose wrong. I don't think that there is no indication that CBD can be beneficial in Crohn's. So now we have another randomized controlled trial. This time now we're looking at a little bit more patients. So this is 60 patients. The last 2 studies were only in 20 patients. And for the first time now we're looking at colitis as opposed to Crohn's disease. And these are patients who weren't responding well to the treatment that they were already on. And they were given 250 milligrams of a CBD rich extract, and this did have some THC in there, so it was about 4% THC. And so if you do the maths, you'll calculate that that was equivalent to about 10 milligrams of THC in each capsule, which is equivalent to about a 25-to-1 CBD to THC ratio. And it was also placebo controlled. And what they found basically was that they put as their primary endpoint was remission rate. So they were trying to get people into colitis remission, which is actually quite a hard task. And I would say that, again, in hindsight, that maybe shouldn't have been the primary endpoint, because it might have been better to just see a reduction in their score. So the score, the activity score in colitis, is called the Mayo score. There's different scores for different types of disease. And they did find that there was a significant improvement in the Mayo scores compared to placebos. So there was a significant effect of CBD in improving the symptoms of colitis when given for 12 weeks. And also the physician's global assessment of illness severity also improved. So the doctors who were treating these patients felt that those who were on the active treatment, who were on CBD, were doing better overall. And also the patients reported that their quality of life was significantly improved with CBD. So I think this is an example of getting the dose right and being able to translate that into seeing a significant improvement in the endpoints, but probably having chosen in hindsight the wrong primary endpoint. So this is some different kind of data. This is looking at a nationwide data set of information on patients with inflammatory bowel disease who do and don't use cannabis. So this is quite a large sample size. So overall, they had 6,000 patients with Crohn's, approximately half of whom are using cannabis, which is a bit of an indicator in itself that so many people with Crohn's are using cannabis. And if you ask people why they're doing that, they will tell you because it helps their symptoms. And there was about 1,500 patients with ulcerative colitis, and again, about half of these are using cannabis and half were not. So they looked at a whole range of information that they had from in-hospital outcomes with these patients and compared those who were using cannabis with those who were not using cannabis. And looking first just at the Crohn's disease patients, they found that cannabis use significantly decreased the prevalence of colorectal cancer. So people who have inflammatory bowel disease are more likely to go on and develop colorectal cancer because chronic inflammation in the gut can lead to cells becoming cancerous and then spreading. And cannabis use was able to reduce the prevalence of colorectal cancer developing in this Crohn's disease population, which may suggest that cannabis is chronically reducing inflammation within these patients. Now, it's only an indication. That would be something that would need to be tested kind of rigorously, but that's what the data might indicate to me. They also had significantly decreased anemia, and they also had shorter mean hospital stay when they were hospitalized for their IBD symptoms, and they had, because of that, they had reduced hospital charges. But they did have some things that were increased. So they had increased abscess formation, and they had increased unspecified bleeding in their lower GI tract, and they had a lower blood volume. So they're, a higher incidence of lower blood volume. So there are things that are changed both in a positive and a negative direction. Looking then at the patients with ulcerative colitis, the cannabis users also had a lower frequency of post-operative infections. So they were less likely to get infections, and they had a shorter mean hospital stay and lower hospital charges than those who weren't using cannabis. But again, there were some other aspects, so that they had higher frequency of fluid and electrolyte disorders, and also a higher frequency of a low blood volume. So these things need to be investigated further as to why they're caused and what they might mean. So then the last couple of studies are some very recent data that's just out this year, looking at really more of a patient's perspective on their medical cannabis use for inflammatory bowel disease. So this recently published paper has come from Australia, and it was asking people about their experiences of using medicinal cannabis. And they asked people about what are the symptoms specifically that are improved by your cannabis use. So you can see the green bars here denote those which are improved, and the red is symptoms which are worsened. So you can see that the symptoms which are most often improved when you ask patients how they find their IBD is, the symptoms that are most often improved are actually abdominal pain, stress, sleep issues, cramping, anxiety, bloating, and depression. So you can see half of those are physical changes, things like abdominal pain, cramping, and bloating, but half of them are psychological measures. So the other side of having a chronic illness, so they're less stressed, they have less anxiety, and they're less depressed. So it isn't just about kind of physical changes in the GI tract, but also improving the positive well-being of patients, chronically ill patients. There were a couple of things that were worsened by medicinal cannabis in these patients. So some patients reported worse sleeping problems, some had more anxiety. If we think back to the data I told you about anxiety, is that THC can increase anxiety. So it may be that patients that are using THC dominant products, for those patients you can also have some anxiety that comes with it. Reduced appetite, so those patients who are using a CBD dominant product may experience reduced appetite, and that's something I'm going to talk about in this lecture. It's that reduced appetite can be a side effect of people who are using CBD. And then a lot of people reported worsening in fatigue, which again is another side effect that's commonly reported by patients using medicinal cannabis. Another interesting finding from this study, which kind of echoes some data that we heard already, is that a lot of these patients reported that they decreased the use of their other medications when they started using medicinal cannabis. So the number one thing that there was a reduction on is analgesics, so less pain relief required. And remember, the main symptom that is improved in these patients is abdominal pain. But there was also a reduction in corticosteroids and other immunomodulators. So this is again giving us a signal that in patients for whom cannabis medicine, medicinal cannabis does work in IBD, they find that they don't need to use traditional medications.